Welcome to another episode of Revenue Cycle Optimized by Infinix. Today, pleased to be joined by Randy Boner, who is one of our client success managers that manages our physical therapy clients. So today we're going to chat a little bit about some of the challenges in physical therapy and how we work with our PT clients. So welcome, Randy. Happy to have you here.
Glad to be here, Kate. Thanks.
For sure. So let's jump right in. What do you think is unique in terms of physical therapy patient access that really makes it different from other specialties?
Yeah, I would say that, for the clients that I work with, getting the insurance verified, getting benefits, checking authorization requirements, these are all things that need to be done prior to the patient coming into the initial evaluation. So ideally, as soon as that patient gets on the schedule, we need to check for insurance eligibility and benefits. And that includes, getting the amount of service limits that are available if the patient used any service limits. So basically, how many visits do they have left? We'll also check if a referral is required, and then prior authorization requirements for that initial evaluation and for the additional physical therapy codes. So, getting all that checked before the patient comes in for the first time is very important.
What prior auth challenges are specific to PT that we don't see in other specialties?
Yeah, physical therapy is a little bit different. I would say that there's two general authorization types. So we can get a new authorization request, which basically, the patient's coming in for the initial evaluation. And then from that, we need to, get a prior auth for their additional visits. Or, an extension. So, the patient has been coming to the practice and, they only have like 2 or 3 units or visits left on their authorization on file. So getting, that reauthorization or authorization extension on file before they actually run out of their visits is pretty important as well. And with that, we obtain the authorization number, effective date range, and how many visits and units that auth is approved for. But yeah, getting a handle on that, authorization extension process is important just to keep it flowing.
It's a really good point. The difference between PT and a lot of other specialties, right, is typically patients are going on a regular basis, sometimes multiple times a week, and that reauthorization process is something that a lot of other specialties don't deal with. So it's definitely a challenge for sure.
Yeah. And also with that, having strong initial evaluation notes being included on those requests is important as well. And on those notes, it's important to have your providers or your physicians do an accurate assessment of the complexity. So that could be low, moderate, or high. Those are also important components when getting authorization.
Great point. Let's talk a little bit about denials. What are the most common denials that you see in physical therapy?
Yeah. So unfortunately, the lack of medical necessity tends to be the number one denial that we see. And it really comes because if a patient's already been seen a good amount of times and they want to keep that physical therapy session going, we'll try to get it approved for additional visits, but the payer might come back and say, okay, we don't think that you need to come back for more visits. I think you're good. So definitely lack of medical necessity is the top denial.
Is that common due to the fact that the documentation doesn't necessarily support the additional visits or doesn't support the necessity?
Mm-hmm. Yeah. So, on the initial evaluation notes, if you want to do an extension, you're going to need an updated progress note. So the patient might have to come in, have another assessment with the physician or provider to get, more detailed and updated information. And if we do get a denial, the provider can write a letter of medical necessity and send that to the payer to kind of appeal that denial. But yeah, getting updated progress notes is very important.
Any advice for how to avoid these denials?
I would just stay on top of, the patients, how they're doing, and if you don't think that they should be coming in, the payer doesn't think they should be coming in either. So it's pretty easy to stay on top of those things if there's, good notes being taken.
It's good advice. So obviously we handle quite a few PT claims, prior authorizations here at Infinix. But how do you see that we help solve some of these common patient access challenges?
Yeah. So kind of going back to my first point about, getting that, insurance verified before the patient even comes in. I would say our ability to integrate with EHR systems makes it really easy to, basically say, as soon as a patient gets on the schedule, we need to check for their, insurance eligibility, their benefits, all that stuff I said in the beginning. It makes it, timely, because you don't want the patient to come in and then have to deal with the patient giving you information where it's like, a lot of these older patients don't know what even insurance they have. They think they have Medicare, they think they have Medicaid, but they don't. So I think being able to integrate makes it pretty seamless and, gets the process going as soon as possible. Also, the accuracy of the patient demographic information is very important as well whenever you're making claims. So, let's say we get a request for a patient and then, through our process, we come to find that, the patient's name is misspelled, they have the wrong date of birth on file, the member ID is incorrect for the insurance, or maybe what they thought was their primary insurance is really their secondary insurance. Anything like that, those things can throw off claims and make it, you're not going to get paid if you don't have the right information. So we'll also, correct that data in the system as well through the integration, which is pretty important.
All really, really good points, especially right now, given all of the staffing challenges we're facing. It's tough for providers. These folks are working really quickly, have a lot on their plates, and so those errors can be pretty common. So getting some help definitely helps with that. Let's talk about prior authorization. How do you see Infinix solving common prior auth challenges in the physical therapy space?
Yeah. So like in our experience, just talking about that initial evaluation. So the first time the patient comes in, it's very rare, but it does happen to where, the payer might require an authorization for the initial eval. So before the patient even comes in, you'll need to get that auth. So, working with us, we'll get that authorization before they come in, which is very important. And then we'll also check at the time of verification, is the initial eval, does that need a prior authorization, but also do these other physical therapy codes need authorization? So before the patient even comes in, you have a good understanding of what you're going to need to get authorization for.
Great. That definitely helps.
Yes.
Yeah,
Sorry.
no, go ahead.
And I think honestly, the most important part of it is, kind of that auth extension process. So, if you have like a rule in place, or using us, you set up a rule where it's like, the patient has 3 visits left. Okay, now that triggers a notification to Infinix to submit for an extension. And then we'll get all the relevant documentation, updated progress notes, stuff like that. So having a rule in place can kind of keep your schedule flowing, and, kind of, you won't have any blockages, oh, this patient can't come in today because you don't have the authorization. So those types of rules help.
For sure. And not only do they help the PT group, but no patients like to receive surprise bills because something wasn't covered, authorization wasn't in place, wrong benefits details. So it's really, really important to stay on top of that and leverage a partner when and where you can.
Absolutely. And patients don't know really about authorizations or anything like that. They're like, oh yeah, I had physical therapy. And when I go, I'm supposed to go tomorrow, but now I can't go because something with an authorization on file is expired or whatever. So patients don't want to deal with that. Your practice doesn't want to deal with that. Let us handle it. Keep everything flowing.
Yeah, because the blowback falls on the practice or the PT group, right? They don't understand necessarily what happened, why they couldn't come in, and so patient satisfaction scores then start to lower.
Yes, yes, exactly.
Awesome. All right, good advice. Any last minute words of wisdom, calls to action that you would give a PT group?
Yeah, I guess like the one last thing is kind of detailed, but being able to distinguish as far as authorizations between units and visits, that terminology alone is different. They don't actually mean the same thing. You could kind of relate them together, but if a payer wants something in terms of units versus visits, that distinction is very, very important. So I would definitely recommend looking into that, which payers need units, which payers need visits, because that could be helpful.
Right. That's really good advice. I'm not sure I knew the difference. So learned something new today as well. So that's great. All right. Well, thank you, Randy, so much for your time. And we hope to have you back soon. Lots of good advice. And thanks again for being on.
Sounds good. It was a pleasure. Thank you so much, Kate.
All right. Thanks, Randy.